So this is chapter 6. It begins on page 98 in your anatomy book. You will see the skeletal system. Learning objectives are there on that page. You have key terms found in the book throughout the chapter. The skeletal system is made up of bones, joints, and supporting connective tissues. Learning objectives: list the functions of bones and describe the structure of a long bone. Name the 3 different types of cells in bone and describe the functions of each. Differentiate between compact bone and spongy bone. Explain how a long bone grows. Name and describe 9 markings found on bones. Name, locate, and describe the bones in the axial skeleton. Describe the normal curves of the spine and explain their purpose. Name, locate, and describe the bones in the appendicular skeleton. Describe 3 categories of joints based on degree of movement and give examples of each. Name 6 types of synovial joints and demonstrate the movements that occur at each. Describe how the skeletal system changes with age. And we're going to look at the case study. Donnelly throws deep for a touchdown. Wilson makes a beautiful catch. Ooh, a nasty hit from number 26. The crowd roared their approval for the wide receiver. On the ground, Reggie Wilson knew that something was wrong with his hip. In fact, he thought he had actually heard the bone break. It didn't take long for the coaches and medical staff to realize Reggie needed help, and it didn't take long for the ambulance to get him to the trauma center closest to the stadium. At the hospital, the emergency team examined Reggie. His injured leg appeared shorter than the other and was adducted and laterally rotated, all signs of a hip fracture. An x-ray confirmed the team's suspicions. Reggie had sustained an intertrochanteric fracture of his right femur. His tibia and fibula were intact. He would need surgery, but luckily for Reggie, the fracture line extended from the greater trochanter to the lesser trochanter and did not involve the femoral neck. This meant that the blood supply to the femoral head was not in danger, so the surgery would be more straightforward. In the operating room, the surgical team applied traction to Reggie's right leg, pulling on it to reposition the broken ends of his proximal femur back into anatomic position, and they verified that with another x-ray. Then the orthopedic surgeon made an incision beginning at the tip of the greater trochanter and continuing distally along the lateral thigh through the skin, subcutaneous fat, and vastus lateralis muscle. After exposing the proximal femur, the surgeon drilled a hole and installed a titanium screw through the greater trochanter and neck and into the femoral head. He then positioned a titanium plate over the screw and fastened it to the femoral shaft with 4 more screws. Confident that the broken ends of the femur were firmly held together, the surgeon closed the wound with sutures and skin staples. Reggie was then wheeled into the recovery room. The surgical team successfully realigned the fractured ends of Reggie's femur. Now Reggie's body will begin the healing process. In this chapter, we will learn more about bones and joints. Later in the chapter, we will see how Reggie's skeletal system is repairing itself. We will also go over word anatomy and learn about some prefixes, roots, and suffixes of different words having to do with the skeletal system. So listing the functions of bones and describing the structure of a long bone come first. Bones act as a framework for the body. They protect delicate structures such as your brain, spinal cord, and even your heart. They work as levers to produce movement. They store calcium and produce blood cells, and that happens in the red bone marrow. The long bone structure. Notice here we have epiphyses. Those are the ends of your long bone. You have the proximal epiphyses, which will be closer to the rest of the body, and the distal epiphysis, which will be further away. The shaft of the long bone is called the diaphysis. The epiphysis has red marrow inside spongy bone tissue. The epiphysis also has cartilage protecting the ends where they meet. There is an epiphyseal line or growth line in the adult epiphysis, but in a child, when they're still growing, this is an epiphyseal plate. The shaft of the long bone, as you can see, we start with a periosteum on the outside. You can see that at the bottom of that list there on the right. The periosteum covers your compact bone, And on the other side of that compact bone is endosteum, and that endosteum covers the inside of that compact bone. And in the middle of that is a medullary cavity where you will find yellow marrow and arteries and veins. We'll name the 3 different types of cells in bone and describe the functions of each. We'll differentiate between compact bone and spongy bone with respect to structure and location as well. Osteoblasts build bone tissue. When they become stuck in the bone matrix, they're called osteocytes. They live there and maintain that bone tissue from then on. Osteoclasts break down bone tissue, and this is resorption. This is how we get minerals out of the bones. So your bones are constantly breaking down and being rebuilt. If you look on page 100, bones are living organs with their own systems of blood vessels and nerves. The bulk of each bone is composed of bone tissue known as osseous tissue. It's the hardest form of connective tissue. Bone tissue contains those 3 types of cells. Osteoblasts build bone tissue, and osteocytes are mature osteoblasts that have become trapped in the bone matrix. They maintain the tissue. And osteoclasts are large multinucleated cells responsible for resorption, which is the breakdown of bone tissue. They develop from a type of white blood cell called a monocyte. Bone's hardness and strength reflects the components of the matrix, which is the material between the living bone cells. This material is rich in the protein collagen and in calcium salts. Both substances are necessary for healthy bones. Without minerals, bones would bend easily, but without collagen, bone would shatter easily, like sticks of chalk. There are 2 types of osseous tissue, compact and spongy. So the 2 types of bone tissue are compact and spongy. Compact bone is hard and dense, and the tissue makes up the main shaft of a long bone and the outer layer of other bones. The osteocytes in this type of bone are located in rings of bone tissue around a central canal, also called a Haversian canal. You can see the Haversian canal here where you have the blood vessels and nerves in the center there. Osteocytes live in spaces or lacunae between the rings and extend out into many small radiating channels so that they can be in contact with nearby cells. Each ring-like unit with its central canal makes up an osteon or Haversian system. Your perforating canals form channels across the bone from one side of the shaft to the other, permitting the passage of blood vessels and nerves. These are also known as Volkmann canals. The second type of bone tissue is spongy bone or cancellous bone. It has more spaces than compact bone, and it's made of a meshwork of small bony plates filled with red marrow. Spongy bone is found at the epiphyses of long bones and at the center of other bones. It also lines medullary cavity of long bones. Bone marrow. We have yellow and red bone marrow. Red bone marrow is found in the spongy bone, and it manufactures blood cells. Yellow marrow is chiefly found in the central cavities of long bones, and it's composed mainly of fat. The long bones of babies and children contain mostly red marrow, reflecting their greater need for new blood cells. And we already mentioned the bone membranes. Okay, so this is a picture of an osteon, kind of under a microscope here. We talked about 2 types of osseous tissue, compact and spongy. Compact bone is hard and dense. This tissue makes up the main shaft of a long bone and the outer layer of other bones. The osteocytes, or mature bone cells, in this type of bone are located in rings of bone tissue around a central canal called a Haversian canal. That contains nerves and blood vessels. Osteocytes live in spaces or lacunae between the rings and extend out into many small radiating channels so that they can be in contact with nearby cells. And each ring-like unit with its central canal makes up an osteon or Haversian system. Your perforating or Volkmann canals form channels across the bone from one side of the shaft to the other, permitting the passage of blood vessels and nerves. So this is an osteon here. Okay, you got your central canal or Haversian canal. You have your lacunae where your osteocytes are located, and then they branch out so they can be in contact with one another. But these concentric rings making up one system is your osteon. What are the scientific names for the shaft? What's the scientific name? Diaphysis. And what about ends? Epiphyses. Epiphyses. What compounds are deposited in the intercellular matrix of the embryonic skeleton to harden it? Well, if you look on page 103, during early development, the long bones of the embryonic skeleton are composed primarily of hyaline cartilage. The conversion of cartilage to bone, this process is ossification, begins during the second and third months of embryonic life. At this time, osteoclast-like cells remove the cartilage, and osteoblasts deposit bone tissue in place of the cartilage. Once this intercellular material has hardened, the cells remain enclosed within the lacunae, or small spaces in the matrix. These cells, now known as osteocytes, are still living and continue to maintain the existing bone matrix, but they do not produce new bone tissue. Osteoblasts and osteoclasts in the bone membranes are responsible for bone growth, repair, and remodeling later in life. The flat bones of the skull and other regions develop from dense, irregular connective tissue membranes instead of from cartilage, and osteoblasts deposit bone tissue within these fibrous membranes. So, what compounds are deposited in the intercellular matrix of the embryonic skeleton to harden it? Those collagen, those calcium salts. Yes. Okay. What are the three types of cells found in bone that we are concerned with?
Osteoblasts, osteocytes, and osteoclasts.
All right. What do osteocytes do?
Maintain.
Maintain. What do osteoblasts do? Build. And osteoclasts? Break down. Good. What are the two types of osseous bone tissue or bone tissue?
Compact and spongy.
Okay. Where is compact? Shaft of long bone and around the outer edges of your irregular bones. And where's the spongy bone?
Inside.
Inside the ends of long bones and inside your irregular bones. Okay. Which protein makes up a major component of the bone matrix? Protein. Collagen. Collagen's a protein. So how do long bones grow? Bones begin as cartilage. Your long bones do, or fibrous membranes, and those are your flat bones. Osteoclast-like cells remove the cartilage of the long bones, and osteoblasts replace the cartilage or fibrous membrane with bone tissue. This is ossification. Osteoblasts are trapped in the bone tissue. The ones that are trapped in there become your osteocytes, and the osteoclast and osteoblast renew bone tissue throughout life. So that's everything we just said when it was under fetal ossification in your book on page 103. So new cartilage grows at the epiphyseal plates. Okay, what is an epiphyseal plate? These are secondary bone forming centers that develop in the ends of your bones at the time of birth or around the time of birth. And these are growth areas of the bone. Now, this is where your long bones grow from. Okay? This is where long bones grow from. Talking about your radius, your ulna, your humerus, your femur, your tibia, fibula. All those long bones grow from this growth plate. Okay? Ossification replaces the cartilage there with bone. When all the cartilage is ossified, the bones will stop growing. And that epiphyseal plate becomes an epiphyseal line. Now, if there is a disruption during the time when it's still a growth plate, if there's a fracture, and by the way, fracture means break. I don't know how many times I've heard somebody say, oh, it's just fractured, it's not broken. Yes, it is. A fracture is a break. So the epiphyseal plate becomes the epiphyseal line. Before that happens, before those ends of long bones harden up, close off, plates are now lines. When it's just a plate, if you have a break there, it can interfere with growth of that bone. That bone may never grow to its full potential. And that can be an issue because what's up with your long bones? Well, you have two of each, right? You have two humerus. I mean, we have a real short arm if it stopped growing, right? One long arm, one short arm. So it could be a problem. It won't grow to its full potential if there is a break before that becomes a line, before it closes. Bone fractures. We're going to name and describe, bone features rather. Name and describe 9 markings found on bones. So if you look in your book on page 104, we're going to go over these bone markings, okay? So the head of a bone is a rounded knob-like end separated from the rest of the bone by a slender region. So when we talked about in the case study, the femoral head, right? That's what we were talking about. It is a knob-like end separated from the rest of the bone by a slender region. So that's found on the femur. A process is a large projection of a bone. So to be a bony process, it's going to be something that sticks out. A condyle is a rounded projection, and then a small projection above a condyle is an epicondyle. So it's going to still be a projection. It's just not going to be as big as a process. Okay? Has anyone ever heard of the olecranon process? Where's the olecranon process? Anybody? The olecranon process. All right, so where is the olecranon process then? The arm, but where?
Back of the elbow.
Back of the elbow, olecranon process. That's a big projection on the bone, right? Yeah? Okay. A crest is a distinct border or ridge, often rough, such as over the top of the hip bone. You can find the crest of your hip bone. You just got to put your hand down on your hip and feel of it. A spine is a sharp projection from the surface of a bone, such as the spine of the scapula, your shoulder blade. A foramen is these are the depressions or holes that we're talking about now, but a foramen or foramen is a hole that allows a blood vessel or nerve to pass through or between the bones. If you have more than one, it's a foramina. But your foramen, the one that I like to think about, is the hole in the bottom of your skull that allows your spinal cord through, the foramen magnum. Okay? So it's a hole in the bone. A sinus is a cavity or hollow space. So in your head, in your skull bones, you have these cavities, these air-filled chambers called sinuses, right? Yeah? Okay. A fossa is a depression on a bone surface. So it's not a hole, it's just kind of like a little valley in the bone. And sometimes we have processes that fit right into those little fossas so that your bones can be kind of connect like that. And then a meatus is a short channel or passageway. When we're talking about bones, it's usually the external opening of a canal. The channel in the skull that leads to the inner ear is one of those. There's a hole, a little channel. It's not really a hole, it's actually like a tube that leads to your ear. So those are bone markings. What are the centers for secondary growth of a long bone called? Do what? I'm sorry, I just could not understand what was coming out. Okay, what are some of the functions of bone markings then? What do bone markings, what are they good for? So that bones can fit next to one another very comfortably. Allow for attachments. Okay, allow for passage of vessels or other structures through the bone. Good. All right, where does bone growth occur in children? Epiphyseal plates. All right, bones of the axial skeleton is next. Now the axial skeleton, what is the axial skeleton? Do what? Yes, the framework of the head and trunk. So we're going to talk about the bones in the head and trunk, the axial skeleton, and we're going to also talk about and describe the normal curves of the spine and explain their purposes. All right, so here is your labeling picture, the skeleton. This is our bone man, and we have a actual skeleton that we can bring out and look at. And I will try my best for everyone to be able to see me when I do that. So we have the cranium, which is your skull, okay? We have the facial bones. We have the mandible. We have the spinal column, the sternum, the ribs, all of that is the axial skeleton, okay? There's 80 bones here, and it's depicted here in beige. The appendicular skeleton is pictured in blue, and this is all your appendages. That's where appendicular comes from. So this is going to include the clavicle, scapula, all the bones of the arms and hand, the pelvis, and all the bones of the legs and feet. That's appendicular, appendages. I'm going to list them, okay? So in your skull, you have your cranium, which is actually made up of 8 bones. The cranium is the chamber enclosing the brain. It houses the ear and forms part of the eye socket. Also in your skull, you have your facial bones. There are 14 facial bones, and they form the face and chambers for sensory organs. The facial bones are your mandible, which is your lower jaw, your maxilla, which is your upper jaw, and that is fused together. There are 2 maxilla, but they're fused together right in the center. Okay. Your zygomatic bones are your cheekbones. Your nasal bones form the bridge of the nose. The lacrimal bones form the anterior medial wall of each orbital cavity and the inferior part of the nasal septum. The vomer forms the posterior part of the hard palate in your mouth. The palatine bones form the sides of your nasal cavities and your inferior nasal conchae or conchae. There are 2 of those. You also have ear bones. I just realized something. Then you have your ear bones inside your ears. They're called ossicles. There's 3 in each ear. Okay, and they transmit sound waves through the middle ear. They're not actually attached to the rest of the skeleton, and we'll learn more about those when we talk about the senses. In the trunk, we have 26 vertebrae that enclose the spinal cord, and the thorax, which consists of your sternum and 12 pairs of ribs. The sternum is the anterior bone of the thorax, and the ribs enclose the organs of the thorax. Here's the skull. I like the other picture that I gave you for labeling better than this one. But as you see here, We have the lacrimal bones. We have conchae, which are inside the nose and are part of the ethmoid. We also have the maxilla, the mandible, the zygomatics. There's the frontal bone. This is the sphenoid bone, the temporal bone, the parietal bone, the occipital bone, and all these little squiggly lines in between are sutures. Now, before birth, those are not fused together. That's so that the bones can, when the child is squeezing, the infant is squeezing through the birth canal, those bones can overlap slightly to make their head smaller to come through the birth canal. And then after birth, they will fuse together. It takes 18 months for the last to close. There's 2 openings that are pretty evident on a newborn baby, and those are what? Soft spots. They're fontanelles. There's an anterior one and a posterior one. Okay. All right, so what type of joint is between the bones of the skull? It is a suture. It is an immovable joint. Once they are sutures, once those sutures form and they harden, they're not going to be able to move those bones. What 2 bones make up each side of the hard palate? What did you say? All right, so again, we have the skull. We're looking at a side view, but then this side view, it's cut right down the middle. And so we're looking at the interior portion. And you can see here, this is the frontal bone in purple at the front. And you can see a sinus there, which is a cavity inside that bone. The upper back portion out here that's kind of peachy colored, that's your parietal bones. You have 2 of those. You have 1 frontal bone, 2 parietals. You have, in this other purple down here at the back is your occipital bone. There's 1 of those. The foramen magnum opens up there, as you can see in the base of the skull. That's where your spinal cord comes through. This kind of pink colored bone above the side of the occipital is your temporal bone. And then you have a green colored bone here, kind of minty colored, is the sphenoid bone, and the darker green is your vomer nasal bone. You have in the yellow, that is your ethmoid bone. And those where the conchae are located that increase the surface area inside your nose. And then you also have another conchae in the blue one, which is the maxilla here, and then your mandible. Okay, so I know you're thinking, that's a lot of confusion. That's a lot of what in the world do I really need to know there? This is the infant skull. And notice how those suture lines are not close together. Those bones have a space between them. Now, the anterior fontanelle is the large soft spot on an infant's skull. It doesn't close till 18 months. And the posterior fontanelle is another fontanelle toward the back of their head, and that closes sooner, and it's within the first couple of months. So which one's larger? Anterior fontanelle. Now, when people have babies, they're often scared they're going to hurt it. It needs good scrubbing like anything else, and that's where infants get cradle cap from people not scrubbing good when they wash their hair. Cradle cap is a buildup of grease and dead skin cells. Yes, ma'am?
Can it take longer, or can it close up later for some kids?
I'm sure. Its average is 18 months.
Over the weekend, I did my daughter, she's 19 months, I felt hers, and it's still...
It's 18 to 24 months.
Well, and she was born early, so I thought maybe that...
Could be. All right, so your sinuses are these air-filled chambers in your skull, in the frontal bone, in the other bones of your skull, and they help. Sinuses help give our skull a lighter weight to it. Otherwise, your head would be too heavy to be supported by that small neck that you have. And it also adds resonance to our voice. Otherwise, we would talk like that if we didn't have those, like we had, swallowed a bunch of helium or inhaled helium. So, yeah, the sinuses are important. Now, the ones that get infected are typically the maxillary sinuses on either side of the nose because they actually open up into the nasal cavity and it gets plugged with mucus, and those can get infected and just stuffy and everything. The others are closed sinuses, less likely to get infection in them, but it can still happen. The vertebral column is still part of the axial skeleton. And this is a side view of the vertebral column. And notice that it is color-coded. Of course, on a person, it's not going to be color-coded. But we have these specific sections here. There are how many sections? 5 sections. All right, so the bony sheath for the spinal cord is made of a series of irregularly shaped bones. These number 33 or 34 in a child, but because of fusion that occurs later in the lower part of the spine, there are usually just 26 separate bones in the adult spinal column. Each vertebrae has a drum-shaped body located anterior or toward the front that serves as a weight-bearing part. Discs of cartilage between the vertebral bodies absorb shock and provide flexibility. In the center of each vertebrae is a large hole, the vertebral foramen. When all the vertebrae are linked in a series by strong connective tissue bands, these spaces form the spinal canal, a bony cylinder that protects the spinal cord. Projecting posteriorly or toward the back from the bony arch that encircles the spinal cord is the spinous process, which usually can be felt just under the skin of the back. You can feel around at your back, and you can feel those knobs of your spiny processes on each vertebrae. Projecting laterally is a transverse process on each side, and those are attachment points for muscles. Other processes form joints with adjacent vertebrae. A lateral view of the vertebral column shows a series of intervertebral foramina formed between the vertebrae as they join together, and your spinal nerves exit your spinal column from the spinal cord from there. So if you are to look at Skelly, we'll pause this for a second and we'll go and look at Skelly. All right, so now that we know what the foramina are, what those processes are, the bones of the vertebral column are named and numbered from superior to inferior, and according to location, there are 5 groups of vertebrae. So we're going to take this whole vertebral column, break it down into 5 groups. The cervical vertebrae are located in the neck. Your C-spine, your cervical spine is here at your neck, okay? Right here at your neck, all right? There are 7 cervical vertebrae. That's important to know. There are 7 cervical vertebrae. The first one has its own name. It's called the atlas. And if you think about atlas, if you hear the word atlas, what's the first thing that comes to mind? From Greek mythology, Atlas was punished and had to hold the world up, right? So Atlas supports the head, just like Atlas in mythology was holding the earth, okay? And it's actually named after him. When you nod your head, the skull rocks on the atlas at the occipital bone. Your second cervical vertebrae is the axis, and that is a pivot point when you turn your head from side to side. It has an upright tooth-like part, the dens, that projects into the atlas as a pivot point. So those two are connected, the atlas and axis. They're kind of connected together. The axis is kind of stuck into the atlas so that you can turn that way. Okay? Did y'all all see that? If this right here, just these fingers, if this is my atlas that's holding up the earth up here, this would be my axis, and it's kind of stuck in there like that so that you can do this. Okay?
Can you bring your hands down a little bit?
Okay. So say I've got the earth right here in my hand. This would be the atlas, this bone right here. And this would be my axis bone, my thumb, and it's stuck in there so you can do this. Now it's still going to have a hole in the center of it. It's still going to be shaped like a vertebrae. It just looks different in that there's a spot that connects to that one above it so that you can turn like this. Okay?
Thank you.
You're welcome. So that's what those words mean. It's kind of hard to picture those words in your head and understand. It's easier to understand anatomy if you can visualize it. Okay? So the absence of a body in these vertebrae allows for the extra movement. Only the cervical vertebrae have a hole in the transverse process on each side, and these transverse foramina accommodate blood vessels and nerves that supply the neck and head. All right, so that was your cervical vertebrae. C is for cervical, and it has 7. When do you eat cereal? At 7. Cereal at 7. That's going to make sense in just a minute. Okay. So the next section of vertebrae are your thoracic vertebrae. I mean, your thorax. That makes sense, right? So you have how many thoracic vertebrae? 12 thoracic vertebrae. They're located in the chest. They are larger and stronger than the cervical vertebrae and have a longer spinous process that points downward. The posterior ends of the 12 pairs of ribs are attached to the transverse processes of these vertebrae. So you have 12 pairs of ribs, you have 12 vertebrae. Okay? What time of day would you be most likely to eat a turkey sandwich? At 12 for lunch. Turkey sandwich. Turkey at 12. Hey, I eat turkey in the middle of the day on Thanksgiving. Turkey at 12. Right? All right. The next section is the lumbar vertebrae. There are only 5 lumbar vertebrae. Only 5. They're located in the small of the back. They are larger and heavier than the vertebrae superior to them and can support more weight. And all of their processes are shorter and thicker. So those parts, the spinous process, are shorter and thicker. So you have your 5 lumbar vertebrae. And what I like to eat at 5 is going to be my supper. And one of my favorite things is going to be lasagna. You're going to eat lasagna at 5. Lasagna at 5. Yeah? Okay. And then we have our sacrum. Our sacral vertebrae are actually 5 separate bones in a child, but they eventually fuse to form one single bone called the sacrum. It's actually 5 bones fused together. They're wedged between the 2 hip bones at the back, and the sacrum completes the posterior part of that bony pelvis. You can feel your sacrum. It's that spot right below where girls get a tramp stamp. Okay, it's between the tramp stamp and the gluteal cleft, or the crack. That's your sacrum. And actually, sacrum goes down a little bit further than that. All right. So, sacrum. Sacrum. We don't worry about meals here at this time because there's 5 and 1 and da da da. That's easy to remember. There's 5 bones fused as one, so it's one sacrum. You have one sacrum. Okay, that's not hard to remember. We don't have a meal analogy here. Now, the last section is the coccyx. The coccygeal vertebrae consist of 4 or 5 tiny bones in a child, but they fuse to form one single bone, the coccyx or tailbone, in the adult. and that's down at the tip end. Now you can break your coccyx and puncture your rectum. It's kind of pointy. When you fall, you can break your tailbone.
I'm glad I didn't do that.
Yeah. So, it makes more sense, my cereal thought earlier, right? So you have cereal at 7, turkey at 12, lasagna at 5. So you can remember which order they're in. So you'll always know cereal is first. There are 7. I ate cereal at 7. And then lunch, 12. There's 12 of those. And the thoracic, turkey at lunch. And then your lasagna at 5 at night, which there's 5 lumbar vertebrae. So that's a good, easy way for you to remember those. So I'd write that down if I were you. You have trouble remembering? Especially when you're trying to figure out which one has 12, which one has 7, which one has 5. You're like, what? I don't know. Okay? Cervical, cereal, 7. Thoracic, turkey, 12. Lumbar, lasagna, 5. Okay? I've had a very healthy meal plan for the day. I was doing all right till I got to the lasagna, right? Could have been vegetarian lasagna. All right, from a lateral view, which groups of vertebrae form a convex curve and which form a concave? So your convex curve means what? Curves out, and that's the thoracic. And what does what's the other, the concave? Means like caved in, so that's your lumbar. What's the point of those? Okay, when viewed from the side, the adult vertebral column shows 4 curves corresponding to the 4 vertebral groups. In the fetus, the entire column is concave forward like a letter C, and your spine, when you assume a fetal position. It's a primary curve. When an infant begins to assume an erect posture, secondary curves develop. The cervical curve is convex and appears as the baby holds its head up at 3 months of age. The lumbar curve is also convex and appears when the child begins to walk. The thoracic and sacral curves remain the 2 primary concave curves, and these curves of the vertebral column provide some of the resilience and spring so essential in balance and movement. Okay, posture, balance, movement. That's important. All right, so there's the vertebrae. If you were looking at the anterior surface, that's where the body is. And the posterior surface, you've got the spinous process. The vertebral foramen is in between those 2. You have the transverse processes on the side. Now, this is a cervical vertebrae, and this is a thoracic vertebrae. Notice how the thoracic vertebrae is just chunkier. Okay, the thoracic's got to be bigger, and the lumbar is going to be even bigger than this. Okay, the cervical doesn't have that much to hold up, but the further down you get, the bigger they need to be to hold up what's above it. Does that make sense? If you look at it from a side view, you'll see they get thicker as well as you go down. Which vertebrae are the largest and heaviest? Lumbar. This is the atlas and axis, and this is looking at it from above, from a superior viewpoint. So you're looking straight down. You've taken the head off, and you're left with the atlas and axis, and you're looking down, and you see the atlas first, and notice how you have the axis underneath it, and there's kind of this dens right here that kind of loops up into it. That's what allows it to turn. That's what allows your head to turn side to side. I would be interested to see the vertebrae on an owl. They like turn their head completely around. All right, so here's the thorax. We have the sternum or breastbone, which is actually made up of 3 parts. Okay, so the bones of the thorax form a cone-shaped cage. 12 pairs of ribs form the bars of the cage, completed anteriorly by the sternum or breastbone. These bones enclose and protect the heart, lungs, and other organs contained in the thorax. The superior portion of the sternum is a roughly triangular manubrium. So up here at the top of the sternum, it's the manubrium. It's kind of triangle-y shaped. And that is joined on the right and left by the clavicle or collarbones. The name manubrium comes from a Latin word meaning handle. The point on the manubrium where the clavicle joins can be seen in this picture, kind of, sort of. It's the clavicular notch on the manubrium. You see that little bit of a curve right there. I don't know if y'all can y'all see my arrow at home, in the other room?
Yes, ma'am.
Okay, right here is the clavicular notch. Okay, and so the manubrium is kind of triangle shaped and it has these little notches on the side, which are the clavicular notches where the clavicles join. Okay, and that's a fossa, right? So laterally and inferiorly, the manubrium joins with the anterior ends of the first pair of ribs. There's the first pair of ribs here, second pair of ribs here, third pair. And so the manubrium is joined to that first pair of ribs. Down below, it joins with the sternum's body. So this is all the sternal body right here, this main part. I think the sternum looks kind of like a tie, like a necktie. So the main part of the necktie then would be the sternal body. And notice how all the other ribs then attach to the sternal body. 2, 3, 4, and 5, and 6 attach directly to. Now this is cartilage that joins the rib to the sternum. And notice how it's not solid bone all the way around. Okay, so the sternum's body is long and blade-like. It joins along each side with ribs 2 through 7. 2 through 7. Okay, and those are considered true ribs. 1 through 7 are true ribs because you can draw a straight line from the rib directly to the sternum. Okay, 2 through 7. But 8, 9, and 10 are false ribs because they actually have to join first up to 7 and then go up. Say 8 is joined to 7, 9 is joined to 7, 10 is joined to 9. So the ones that go directly from, has cartilage going directly from rib to sternum, those are true ribs. These are false ribs because they do not go directly to the sternum. They have to attach to a rib above it. Does that make sense? Perfect. Where the manubrium joins the body of the sternum, there's a slight elevation. It's called the sternal angle, and you can feel that as a surface landmark. If you were to feel, you feel that where it kind of comes into a bump right there. Yeah? Okay. The inferior end of the sternum consists of a small tip made of cartilage in youth but becomes bone in the adult. This is the xiphoid process down here. So the triangular portion at the bottom is the xiphoid process. It's used as a landmark for CPR to locate the region for chest compressions. We go 2 fingers above the xiphoid process because if we do CPR over the xiphoid process, we're going to break it off. Okay? So all 12 ribs on each side are attached to the vertebral column posteriorly or in the back. So notice how number 1 is up there connected to the vertebral column. 2 is, and then 3, you can't see it all in here, but you come down here, 11 is connected, 12 is, all of the ribs, all 12 pairs are connected to the vertebral column directly. Okay? The true ribs are the first 7 pairs. They directly attach to the sternum, as I said. False ribs are the remaining 5 pairs. Of these, the 8th, 9th, and 10th attach to the cartilage of the rib above it. So those are false ribs. And then the last two are floating ribs. Those are numbers 11 and 12. They're your floating ribs. They have no anterior attachment at all. There's no cartilage connecting them to the ribs above them. They're just floating out there on the side. And you could feel them around back here. Okay? They don't come all the way around the front. The one down here is your number 12. And that 12th rib, as you see, comes down and kind of the tip of it is by your first lumbar vertebrae. The tip end of it, so it kind of comes in a downward angle. Okay? So, to what bones do the costal cartilages attach? Yes, costal means rib. So when we're talking about costal cartilage, it's from the ribs to the sternum here. Okay? All right. What bones make up the skeleton of the trunk? Ribs, spinal column, closes it in the back, and then your sternum, right? What are the 5 regions of the vertebral column? Cervical, thoracic, lumbar, sacral, coccyx, coccygeal. All right, how many cervical vertebrae do we have? 7. How many thoracic? 12. How many lumbar? 5. Good job. All right, which bone forms the back and part of the base of the skull? Back here, back of your head. Occipital. All right. So we're going to do the appendicular skeleton next. So you have thus far learned the major bones of the skull, all the vertebrae, and all the ribs, right? You know how many true, how many false, and why they're true and false, which ones are floating. So you have already learned 80 bones. Can you believe it? Yes, ma'am.
On that picture of the ribs, it says false ribs 8 through 12, and then floating ribs 11 and 12. Do we just need to remember that floating ribs are 11 and 12?
Yes, you have true ribs and you have false ribs. 2 of the false ribs are floaters. That's 11 and 12.
What are the floating ribs for?
They're still there for protection. They're protecting your kidneys. Okay. But you still need to be able to move and bend, and if those came all the way around, you'd have less flexibility, less movement in your... Yes, ma'am.
Is there any difference between the male and female?
No. Anatomically, there is no difference in the rib cages from a male and female as to number. Now, the size may be different. They may have bigger bones in a male than a female. But I know that you're thinking back to the Bible and how God took a rib from Adam and made Eve. Okay? That may be absolute truth. I'm not going to argue with that. I believe it. I do. But Cain and Abel were born with all their ribs. So we still have all our ribs. Women do not have a different number of ribs than men. And no, you can't have ribs surgically removed. So don't ask me that either. That would be very dangerous.
Yeah. That's why I was confused. You said that.
And other reasons, but we're not going to get into that. All right, so we're going to talk about the bones in the appendicular skeleton now. All right, so appendicular skeleton, we're talking about our arms and legs, right? Okay, so in the upper appendicular skeleton, the upper division, we have our shoulder girdle. The shoulder girdle is made up of the clavicle and scapula. Okay, shoulder girdle, and that is the clavicle is between the sternum and the scapula, and the scapula anchors muscles that move the arm. So your shoulder girdle, it helps your arm to move. Okay, if you break your clavicle or your collarbone, then it's going to be difficult to move. Okay. All right. In the upper extremity, coming off the shoulder girdle, you have your humerus, arm bone. Hit your elbow on the desk. Hit your elbow. That's the funny bone. That's actually, your elbow is the process from the humerus, okay? Your humerus doesn't bend. The forearm bends around it. It pivots, okay? So that is actually your humerus, okay? It's the funny bone. It's not spelled the same, but that's why it's called the funny bone. You hit it and it feels funny. Actually, it hurts. It doesn't feel funny at all. We're not laughing about it. It's got a weird feeling, but you know, that's because you're hitting a nerve when you do that usually. Next, we have the radius and ulna. These are the two bones in your forearm. How many of you know where to check a radial pulse? Check your radial pulse. Find it. Can you all see me at home? Can you see me? The radial pulse. Every nurse knows how to check a radial pulse. It is follow your thumb straight down to your wrist and find the little pulsations, as someone once asked me, the little bumps. Pulsations. They're pulsations. So right there's a radial pulse. Why is it called the radial pulse? Because it's by the radius, the radial bone, right there. The radius bone in your forearm comes right down from your thumb to your elbow, okay? That's the radial bone. And the other bone in the forearm is the ulna, okay? You have a radial nerve, you have the ulnar nerve, you have radial vessels and ulnar vessels, and it's talking about which side of the arm it's on. So always know that radial comes down from your thumb, okay? Radial from the thumb. So that's your radial and radius and ulna. And then your wrist bones are your carpals. You've heard of carpal tunnel surgery? Where do they do that surgery? The wrist. Actually, they go in the palm of your hand, but they go down in there and they slice open a sheath that has gotten too tough from repeated use. Okay? You keep using it, typing, and a lot of this flexion of your wrist and a lot of movement, and it makes that sheath really, really tough. And that sheath goes down in through those carpal bones, and it becomes real tight because it can't grow outwards. It gets real tight inside, and it cuts off blood supply and nerve supply, and so it makes your hands hurt, your fingers go numb, and they go in right here on your palm of your hand and get down in there, and they cut open that sheath, and then they leave it open forever and ever, amen. Okay, so if you can see that, but they're working on that sheath that's going through the carpal bones. That's the carpal tunnel, okay, and it's gotten too tight in there. So carpal bones are wrist bones. We're not going to name them all. I do not care what their names are. It does not matter to you what their names are. Does not matter to me what their names are. If you're curious what their names are, it's on page 113. The hamate, pisiform, triquetral, lunate, trapezoid, trapezium, capitate, and scaphoid. I don't care. I'm not going to ask you to label it. There's no reason why you should know that. You're not an orthopedist. Okay? Okay. They're carpal bones. That's all that matters. Now, the next bones are your metacarpals. Metacarpals are wrist bones, guys. They're in the wrist, and you can feel them in the back of your hand. They have names. I don't care what they are, but I can feel 1, 2, 3, 4, 5. Okay? It's this one, 5. So I have all those 5 bones. They're just metacarpals. Carpals, metacarpals. Don't get carpals and tarsals mixed up, guys. We don't have carpal tunnel on our ankles. We have it on our wrists. Carpal tunnel syndrome. Typists. Okay? So, metacarpals. Carpals, metacarpals. Don't get them mixed up with the tarsals. Carpals, metacarpals. And then phalanges, which are your finger bones. Okay? Thumb has 2 phalanges. That's why you only have 1 joint there. And your fingers have 3 phalanges. They probably all have names. They do have names. And the only reason you would need to know these names, and not that they're individual names, just we number them kind of, okay? So your proximal phalanx is the first one. Your middle phalanx is the middle one, and your distal phalanx is the tip of your finger. Okay, and the only reason you would need to know these is when we're talking about the proximal interphalangeal joint and the distal interphalangeal joint, the pip and dip joints for arthritic explanations that we talk about when we talk about arthritis way down the line in med-surg. Those joints, you got the proximal joint and the distal joint, pip and dip. That's the only reason you would need to know that. Otherwise, they're just phalanges. That's it. And that's the upper extremity in its entirety. Okay? And you have another set on the other side of you, so you don't have to learn. Right? So you're really learning a lot less bone names than you thought you was going to, right? You forgot about the duplicates. Okay. Lower division starts with the pelvis. Pelvis is the ox coxae or os coxae. There's two os coxae. There's one half and another half. Os coxae. Together they make up the whole pelvis with the sacrum. Okay? Os coxae. 1, 2. They come together to make up your pelvis with your sacrum. Make this my sacrum. There we go. Here's my pelvis. Os coxae. One half is right, the other half is a left os coxae. Together it's a whole pelvis. Now, the pelvis, if you look on page 113 at the bottom, this is important for you to know. You do not have to label this for me, but you do need to know that this is what it is. Okay, you are going to name the iliac crest or spine one on the pictures. So the ilium is the large bone on the top, the large outer part of the funnel of the pelvis, because it's kind of funnel shaped. Okay, so that your hip bone that you feel here, that's your pelvis. Okay. Then you have another section that is the ischium and the pubic bone. So the ilium is the upper flared portion. Iliac crest is that rim along the top. The iliac spine is another portion of it. The ischium is the lowest and strongest part. The ischial spine at the posterior of the pelvic outlet is used as reference point during childbirth. And then the pubis is the anterior part of the os coxae, and the joint formed by union of the two hip bones anterior is the pubic symphysis. So if you look on page 114, you can see this very clearly. The os coxae, all right? You have male versus female. This is how they can tell by looking at a skeleton whether it was male or female. The male skeleton is more narrow, has a more narrow pelvis. It's longer and narrow, and the female has a wider, more flared pelvis for childbirth. Okay, women can have a more narrow pelvis. You can have a android pelvis like a male, and it makes childbirth very difficult. Okay, you've heard the term childbearing hips. Okay, that's this. You want that gynecoid pelvis shape that women have. There's another couple of odd shapes that we'll talk about in OB, but we're not worried about it now. So we have the male pelvis and the female pelvis. Notice the ilium is the outer flared. The ischium is the lower portion in the back. The lower portion on the sides. And then the pubic is the front portion. And you have a little piece of cartilage there. And in a female, that will separate to allow for childbirth, make the pelvic outlet bigger. Okay? So that's your pelvis. Now, next question we have, or next thing we're going to talk about is the lower extremity. So we talked about our hips, right? But we're not done with our hips, are we? Because our hip joint is there. That's part of the pelvis, part of the thigh. So that's all hip over here, right? When someone breaks their hip, it's typically the femur they've broken. Okay? You're not going to hear someone, they broke their ilium. They might break their ischium. They might break their pubic bone, but you don't usually hear someone break their ilium. Now, the ilium is where we do bone marrow aspiration for bone marrow transplants, because it's a nice big flared portion. You can get it's nice and thick, and you can get in there and get that red marrow out. It's a nice source. It's a big bone. So you don't hear people breaking their ilium usually. Now, unless they've crushed their pelvis, that's a different story altogether. You have a car fall on you, then you might have broken your ilium. All right, so the lower extremity is made up of the femur, patella, tibia, fibula, tarsals, metatarsals, and phalanges. So the femur is your thigh bone. It is the longest and strongest bone in your body. And it is difficult to break the femur if it is structurally sound. It is easy to break the femur if you are elderly and have osteoporosis. Falls with a break usually results in a broken femur, broken hip. It's the femur they're talking about. And those usually start the downward spiral in the elderly towards death. It's hard for them to recover from that. So once they can't heal the bone, then everything else starts to decline, because if you don't move it, you lose it. If you don't move it, you can't breathe good. If you don't move it, you can't make your bowels move good. If you don't move it, you get blood clots and 500 million other things that happen when we stop moving. Okay? So that's usually the beginning of the downward descent in an elderly person. So the femur is the longest and strongest bone in the body. It is hard to break. When you see a femur fracture, especially if it is a spiral fracture in a child, think child abuse, because that's very hard to break. And how did it get twisted? What did they do? Fall out of the car? You shut the door and drug them down the road and they went twirl? I don't know how. No. No. Think child abuse. Except there are situations where that can happen, and that is with diseases that affect bone integrity. Okay? Diseases that affect bone integrity, like leukemia, they would be more likely to sustain a femur fracture, and it could be spiral. It wouldn't take much when their bones are weak. Can't remember the name of it right now because my brain isn't there. But anyway, there's cancers of the bone that will structurally weaken it. So that's a different story. Okay? But in a very healthy child, it's very difficult to break that bone, especially spirally. Yes, ma'am.
What is the medical term for brittle bone disease?
Osteoporosis.
Oh, it is osteoporosis.
Osteoporosis is brittle bone disease. There's other diseases that make the bones brittle, but that's the one that you're thinking about.
So that you can be born with that, though?
You can have osteogenesis progenitor, I think is the name of it, and that's brittle bones that you're born with. Did I get the name right? Osteogenesis progenitor, and people have been accused of child abuse in those cases when it was just a disease that the child had. So, and it's not something that you think about. It's like, hey, when you hear hoofbeats, what do you think? Horses. You don't think zebras. We're in the United States, in southern United States. We ain't got no zoo in town. So when we hear hoofbeats, we're going to think horses, not zebras. And that's one of those situations. When you see spiral femur fracture in a child, you think child abuse. You don't think osteogenesis progenitor or imperfecta. Osteogenesis imperfecta. I can't remember right now, but yeah, you don't think that off the bat. You think the most likely culprit. It's most likely horses, so we're not going to be thinking about zebras. All right, patella is your kneecap. Some people think the kneecap has no function. The kneecap does have function. Trust me, I know someone that broke their kneecap and they could not bend their leg because it is an attachment point for muscles and as a very important part of that lever system called your knee. Okay, without the kneecap, you're not going to be able to walk or even bend your knee.
I had a bone spur right at my kneecap.
Woo.
And I was walking and it would make go down, like my leg was gonna give out.
Yeah. That couldn't have been nice. All right.
I ripped my meniscus behind my left knee, and it is, I mean, it's not my big cat, but sort of feel like it.
All right, so the next bones are in your lower leg. Now, people get these mixed up all the time. You have the tibia and fibula. Tibia is the medial bone of the leg, and the fibula is the little bone on the lateral side, okay? If you look at your ankle, everybody look at your ankle right now. Pick your foot up, look at your ankle. You have a malleolus, which is a projection from the side, from the inside. You've got the inside of your ankle. You guys, I'll show you my ankle if you want to see my ankle. So here is my medial malleolus. That bone right there is not your ankle. It's part of your tibia. That is your tibia. And on the outside, which I can't bend my leg in that direction, you have another one. And that one, my friends, is the lateral malleolus, and it's still not your ankle. It's your fibula bone. It's a process on your fibula. So those little bony projections down here at the bottom of your leg is not really your ankle. Doesn't that blow your mind? They're leg bones, not ankle bones. Now, yes, they form part of the ankle joint. But when we're talking about true ankle joints, ankle bones, we're talking about tarsals. But your tibia is the big bone in the leg, tibia. The fibula is the little bone. It is hard to keep the spelling straight, guys.
I remember those is with the tibia, you can get those more weight, and so I can stand tall. And the fibula, it can't bear weight, so I can fall.
Yeah, fibula can't bear weight, fall down. Tibia, you can bear weight, stand tall. That's a good way to remember it. I always think about a little fibula. Don't tell little fibulas. They're bad. Little fibulas. Okay, tibia, fibula. Now we're down to the ankle bones. Okay, so those are connected right here at the bottom of the tibia and fibula. We're talking about the tarsals now. The tarsals are your ankle bones. Your ankle bones. And there's the cuboid, the cuneiforms, navicular, talus. The only one I want you to remember is the calcaneus, and that's your heel. The calcaneus is the only one of those I want you to remember the name of. It is one of the tarsal bones. It is your heel bone. That's where you get heel spurs. That's where you bear weight. It's the biggest one out of that group. Okay, calcaneus. After your tarsal bones come your metatarsal bones, and those are the ones that are in the body of your foot. All right, in the body of your foot, where your arch is on the bottom, where the top of your foot is. That's where those are. We got a pulse. We like to check there. We got a pulse. We like to check behind your medial malleolus too. There's a pulse point behind the medial malleolus. Now the phalanges are again your digits. Your toe, the great toe, as we call it. The great toe has 2 phalanges, and all the rest of them have 3. Okay? And notice here, we're not even talking about the joints on this foot. If you look on page 115, it doesn't even name those joints. And now you have learned all the bones in the axial and appendicular skeleton that you need to know. Isn't that great? No, I'm not going to ask you to tell me how many tarsals and phalanges there are. Okay, not going to worry about that. All right, so shoulder girdle, again, scapula and clavicle. All right, it has the acromion process up here. And that's a projection. All right, you can feel for the acromion process when you are going to give a shot. You want to You feel that, and you come on down to here, you can feel the process on the outside of the femur, or not the femur, the humerus right there. You're going to put 2 fingers below it, and then open up your next fingers down, and you can, no, you're on the front. You need to be on the side. 2 fingers, next finger open. You got a pencil in your hand, you can't open. That's where you're going to give an intramuscular shot right there. I like to do it with my 2 fingers this way, so I got a nice big spot. It's better. Okay. All right. Of course, I can't do that from this angle. I can't reach my hand around behind me and do it. All right, so that's that. This is the scapula. There's a coracoid process. There's the acromion process again. There's the spine of the scapula. There's a glenoid cavity. There's cavities and processes and fossas all over these bones. Okay. Here's the humerus, the head of the humerus here. And down here is the lateral epicondyle. And that's your, you can feel it right here. Medial epicondyle. There. The one that don't go away. Yeah. You can feel those in your arm. Bones of the forearm. There's a little notch where the radius and ulna are at. And there's processes. And I'm not worried about you naming all this stuff. I don't think that's important for you guys. Notice how the movement of the forearm, because of the way they're put together, allows the radius and ulna to pivot around each other. You can't really do that with your lower leg. You know, you got 2 bones in the lower leg, and you can't do that same thing with, but the radius and ulna do that. Isn't that cool? Pivot around. All right, so here is the humerus on x-ray. You have the radial head, the radius, you have the radial notch right here, you have the ulna bone, you have the trochlear notch where the humerus comes in, the ulnar olecranon, that's the ulnar olecranon process. Anyway, okay, so here's the hand. We've already gone through all this. We did it on the other. We're more worried about that we have phalanges, we have metacarpals and where they are, we have carpals and where they are. And then here's the hip, the pelvic bones. So again, here's the ilium. The ischium is the purple one, and the blue one is the pubic. Yeah. So the front's the pubic, and the back bottom is the ischium. Hard to remember. So the ilium's up here for sure. Lower extremity, head, neck of the femur. You can see that there's all these little depressions and projections on here, and that's so that the skeleton can fit together. It's kind of like puzzle pieces. Okay. And then here's the lower extremity, tibia, fibula, and here's your ankle bones. There's your calcaneus back there, the rest of your tarsals, your metatarsals right along here, and your phalanges. What are the 4 regions of the appendicular skeleton? Yes. Shoulder girdle, upper extremity, pelvis, lower extremity. Which of the following bones is found in the shoulder girdle? Scapula. All right. We're going to talk about the joints now. The joints of your body. We have 3 categories of joints. We'll categorize those based on degree of movement and give examples of them. And we name 6 types of synovial joints and demonstrate the movements that occur at each.
Mr.
Well, just a moment. We have 3 types of joints based on how they move here. So immovable joints are called synarthroses. They are fibrous. There is no joint cavity. It's fibrous connective tissue that joins the bones together, and these are your sutures between skull bones. Those are immovable joints, also known as synarthroses. Synarthroses are immovable joints. I'll say again, synarthroses are immovable joints. Amphiarthrosis are slightly movable joints. Okay, amphiarthrosis are slightly movable joints. There is no joint cavity, but you have cartilage or fibrous connective tissue between the bones. Your pubic symphysis and the joints between your vertebral bodies are your slightly movable joints, or amphiarthroses. Freely movable joints are diarthroses, and they do have a joint cavity that contains synovial fluid for lubrication. Examples of those are your gliding, hinge, pivot, condyloid, saddle, and ball and joint or ball and socket joints. So your diarthroses are your synovial joints, okay? They have synovial fluids. All right, so this is a synovial joint. The hip joint is a ball and socket type joint. There's a housing of ligaments and fibrous joint capsule between the humerus and the pelvis, making up the hip joint. You have, if you take away that fibrous connective tissue and the ligaments, then this is what you would see. You have the acetabulum of the os coxae, which is the socket, and you have the head of the femur, which is the ball, and they fit together like this. This allows for the hip joint to move and rotate in different directions. It moves in that joint kind of freely. All right. Notice here you have the capsule, the fibrous capsule. You have some articular cartilage on both surfaces, both on the head and on the acetabulum. And in between them is a space that has that capsule with synovial fluid. Your synovial membrane houses that fluid. What's the purpose of the greater trochanter of the femur? If you want to know the answer to that, if you look into the back of the book, Chapter 6, Zooming In questions, number 619, the greater trochanter is a point for ligament attachment. What type of tissue covers and protects the ends of the bones? Articular or hyaline cartilage covers the ends of a bone. So that's ligament attachment right here. Okay? All right, so here's the knee joint. The knee joint is a hinge joint, and your book also calls it, or just calls it a hinge joint. So a hinge joint is going to bend in one direction only, okay? Just one direction only. Now, your hip is not your only ball and socket. Your shoulder is a ball and socket as well, okay? And it can move in all kinds of ways, okay? But your knee is only going to bend one way, right? All right, notice here you also have a capsule with synovial membrane and fluid. You also have hyaline or articular cartilage on the ends of the bones. And this lovely synovial joint has that synovial fluid for that gliding and lubrication. Synovial joints. We have different types of movement, and this is where you are going to practice with me. So you're going to do this with me. I'm going to take your word for it that you're doing this because I cannot see anyone but Zenobia's blank screen. Okay? So for your hand, for your fingers, let's flex our fingers. Flexion means bending. Flexion means bending. To flex something is to bend it. So we're going to flex. Extend means to straighten. Straightening our fingers. Flexion, extension. Flexion, extension. Flexion, extension. All right. Abduction means to take away from the midline of the body. So if you abduct your arm, you're moving it up and away from your body. To adduct means to add back to the midline of the body. So you take it back down to the midline. Okay? Abduct, adduct. Abduct, adduct. Let's just fly now. Ab, add. Ab, add. Ab, add. Okay. Now we're going to use our feet. Okay? You can't see my feet. But I'm going to show you. Oh, y'all forgive my feet. So I have my foot. Can y'all see my foot at home? I'm going to invert by moving my foot, bending it toward the midline. Okay, invert. Evert is to point it away from the midline. Inversion, eversion. Inversion, eversion. Okay? Fun times. You get to see my white socks. Rotation. Turn your head back and forth. This is rotation. I should have went to the foot, the other one for the foot next. So if you want to see my foot, this is neutral. Okay? This is extended. Okay? That's neutral for the foot. Because your other two movements for your foot are going to be plantar flexion and dorsiflexion. Neutral. Plantar flexion, dorsiflexion. Okay? Now, circumduction, you take your arm and make it go in a circle. Circumduction. And my personal favorite movement of joints is going to be pronation, supination. Pronation, supination, like I'm holding a bowl of soup. Pronation, supination. Pronation, supination. Okay? When your body is in the prone position, you're face down. It drives me crazy when I'm reading a book and they're saying they're laying in the prone position looking at the ceiling. What'd they do? Break their neck? It's a pet peeve. Prone is face down. Okay? Supine is face up. Pronation, supination. Yes, drives me crazy. I read all kinds of books and they're in the prone position staring at the ceiling. They must have broke their neck. Somebody came along and twisted it. I don't Yeah, supination, up is in the word. Soup, up, good. And one year we came up with a Macarena song. I think it was last year, a Macarena, just to the Macarena beat. So let's see if we can figure that out, okay? So, the different types of synovial joints, which we have already decided were what type of joints? They fall into which category? Freely movable, diarthroses. They're synovial joints, okay? It's another way of saying it. So your synovial joints, we have our gliding joints where we have flat bone surfaces sliding over one another with little change In joint angle, so when we're doing our wrist has gliding joints, right? Okay. And then hinge joint would be your elbow and the joints between the phalanges of your fingers. These are hinge joints along with your knee. Allow movement in one direction. A pivot joint allows rotation around the length of the bone. Pivot joints are for rotation. The joint between the first and second cervical vertebrae, your atlas and axis, and joint at the proximal ends of the radius and ulna, or proximal ends up here. Okay? The collandoid joint. This allows movement in two directions. This is why we can take our fingers and we can bend them over or we can spread them out. We can do the spot move. Okay. The joint between the occipital bone of the skull and the atlas and the metacarpal and the first finger phalanx right here. So we can go side to side and forward and back. Okay. Your saddle joint allows movement in three directions: flexion, extension, adduction, and abduction, and rotation. So we can not only bend it this way, we can go sideways, or we can go in a circle. Okay. And then we have the ball and socket joint, allows the greatest range of movement, including circumduction. That's your shoulder and hip joint. We can go abduction, adduction, circumduction. Okay? What are the three types of joints based on degree of movement they allow? Synarthrosis, amphiarthrosis, and diarthrosis. We also call our diarthrosis our synovial joints. And that, what is the most freely movable type of joint? Do what? Well, which is the diarthrosis, but the one particular joint, the one down to the very ball and socket, is the most freely movable type of joint. Freely movable joints are also known as diarthroses. And we're going to describe how the skeletal system changes with age now. In the bones themselves, we have loss of calcium salts and collagen. The bones become weaker, and we have a reduction in collagen. In the joints, we have thinning of our cartilage and decrease in flexibility. Okay? How many of y'all could do the splits when you were 12? How many of you can still do the splits now? Not as many. You lose flexibility as you get older. All right, so before we get into the case study, remember something that I did not point out before. I did in the last lecture. Muscles are connected to bones via tendons. Bones are connected to bones via ligaments. Ligaments are bone to bone. Okay? When you sprain your ankle, you've sprained those ligaments. Not a lot of muscle down there. Okay? Ligaments are bone to bone. All right. So our case study. So, Doc, what's the chance my leg's going to heal up enough to play football again? Asked Reggie. Well, replied the doctor, you've had a complicated injury and it's going to take some time to heal. When that happens, it may be better than new, but we'll have to wait and see what your prospects are for catching footballs again. Surgeon knew that even before the surgery to realign the broken ends, Reggie's femur had already begun to heal itself. Immediately after the injury occurred on the football field, a blood clot formed around the fracture. A day or two later, chemical messengers within the clot would stimulate blood vessels from the periosteum and endosteum to invade the clot, bringing connective tissue cells with them. Over the next several weeks, fibroblasts and chondroblasts in the clot would secrete collagen and cartilage, converting it into a soft callus. Meanwhile, macrophages would remove the remains of the blood clot, and osteoclasts would digest dead bone tissue. Soon after, osteoblasts in the callus would convert it to spongy bone called hard callus. Months after the injury, osteoclasts and osteoblasts would work together to remodel the outer layers of the hard callus into compact bone, resulting in a repair even stronger than the original bone tissue in Reggie's femur. During this case, we saw how fractured bones are repaired using screws and plates. We also saw that the body has its own orthopedic surgeons, cells like osteoblast and osteoclast, which can engineer a bone repair that is even stronger than the original. Blood clot, how a fracture will heal. First, you're going to have a blood clot that will form around the fracture from those disrupted blood vessels. The blood vessels will grow into the clot, pulling connective tissue with them. Fibroblasts and chondroblasts will convert the clot into a soft callus. Macrophages will come in and eat up and remove the remains of the blood clot, and osteoclasts will resorb the dead bone tissue. Your osteoblasts will convert the soft callus into a hard callus of spongy bone, and those osteoclasts and osteoblasts will remodel the hard callus into compact bone, so you can end up with a stronger bone than you had to begin with. This is how they can see on x-rays if someone has had multiple broken bones because of the way that the tissue heals. Okay. Reggie fractured the proximal end of a long bone. What is the scientific name for the bone region involved? The end of the long bone is called a epiphysis. Would Reggie's fracture line contact red marrow or yellow marrow? Red. During the healing process of Reggie's fracture, which cell type would produce new bone tissue? Osteoblasts produce new bone tissue. Okay. Reggie's fracture extended from the greater trochanter to the lesser trochanter. Does it cross the proximal or distal end of the bone? Proximal. Reggie's fracture extended, wait, we did that. Would this fracture pass through the medullary cavity? No. Give 3 terms that describe the joint involved in Reggie's fracture. All right, so the hip joint is what type of joint? Ball and socket, which is a type of synovial joint. It has synovial capsule, and those are considered diarthroses. Good. All right, so here's some word parts that we came across in this chapter. Clast means to break. Osteoclast breaks down bone in the process of resorption. Dia means through or between, so a diaphysis or shaft is a long bone between the 2 ends. Dia means between. Os or osseo is osseous for bone tissue. Osteo also means bone. Periosteum is a round bone, around the bone. The bones of the axial skeleton, some terms we found, costa or costo means rib. So intercostal spaces are between ribs. Costal cartilage connects ribs to the sternum. Para means near, and paranasal sinuses are located near the nasal cavity or the nose. Parieto or parieto means wall, and parietal bones are the side walls of the skull. Bones of the appendicular skeleton, we learned infra, that means below or inferior, and an infraspinous fossa is a depression inferior to the spine of the scapula. Meta means near or beyond, and the metacarpal bones of the palm are near and distal to the carpal bones of the wrist. Metacarpal, near and beyond the carpals. Okay. Supra means above or superior, and a supraspinous fossa is a depression superior to the spine of the scapula. Joints, ab means away from, abduction, moving away from the midline. Ad means toward or added to. Adduction is movement toward the midline of the body. Amphi means on both sides, around, or double, and amphiarthrosis is a slightly movable joint. Arthro means joint or articulation. And circum means around, and circumduction is movement around a joint in a circle.